This morning, we again invited Dr. Ajay Sethi on the show to break down some of the COVID headlines this morning.
Dr. Sethi, an associate professor of population health sciences at UW-Madison. Thanks again for waking up so early, doctor.
Thank you so much.
So I want to start with this decision to extend the mask mandate. What do you think about it? Do you think this is the new norm? Are we ever going to have a time when we won't have to wear masks?
Yeah, I think so. I mean, if case rates can come down to a level that makes us feel safer in the community, the mask will probably come off. Of course, we did that last summer, and then you know what happened afterwards. So this is a problem with pandemics, is that when we let our guards down, a new variant might take over, warranting us to put the mask back on. But we'll let the science decide whether we should have a mandate or not, and that's what public health does. There has to be an expiration date to these mandates so the science can be regularly reviewed.
Yeah, I think that's the big question right now is what is that level? Where's the bar at now? But a lot of people, Dr. Sethi, are looking for a glimmer of hope here. So talk about Pfizer's new pill, Paxlovid. Is this something that we can look forward to hopefully get a little bit of relief for hospitals and ultimately perhaps bring a solution here at some point?
Yeah, this is a promising drug. It's something that can be taken within 5 days of testing positive. If you take it early, it shows that you can ward off, hospitalization and a worse outcome by 90%, which is, very significant. The drug is in scarce supply right now because it just got authorized. So we need to wait for those supplies to come up in order for more people to have access to them. And right now they're reserved for people who are the most vulnerable, people with weakened immune systems, transplant patients, older patients.
Another glimmer of hope, cases are decreasing in Dane County, and we're seeing them decrease across the country in certain places. I know public health has said it's too early to say that we've hit the peak of Omicron, but what's your expert opinion? And do you think there's been any sort of silver line when it comes to Omicron?
Yeah, I mean, for one thing, the cases there's definitely a turnaround. We can see that in the curves. We have to be a little cautious because there are some states that had a turnaround only to have a swing right back up in the cases. Some of our neighboring states, like even Minnesota. So let's just wait a few weeks to see if we can sustain this. I think the silver lining is that overall Omicron ended up being a little bit more mild than Delta. Not for everybody. A lot of people are in the hospital because of Omicron, but it could be worse if this variant was worse. And luckily it's something that is not as bad as the previous variants.
We're running out of time here, but really briefly, do you think it's a matter of time before we see another variant of concern?
Yeah, it's just a matter of time. I mean, Omicron already has a sublineage. They're dubbing it son of Omicron. It'll take time to study that, but yeah, the virus will continue to evolve. We can expect more variants.
All right, Dr. Ajay Sethi, thanks so much for waking up early and talking with us. We appreciate it.
Thank you so much.